doctor who came in to say, we'll give you a few minutes to think about whether you want to end your dog's life or pay $11,000.
$7 million.
Yeah.
$11,000, really?
Only, yeah, there was a range. It was from 8 to 11. It ended up only being 8.
Oh my gosh.
Yeah.
What happened to him?
He got dilatation volvulus syndrome, where it's called bloat,
Oh,
where his stomach flipped over,
Mhm.
and it's a fatal thing within hours. It'll
Yes.
kill him.
My neighbor's dog had this happen.
I
Yep.
had it happen to 2 of mine. One survived, one didn't.
Yeah. So luckily he got there in time. We coughed up the dough and he's home again with a giant incision, but he seems okay.
Mhm.
In my opinion, having gone through that with a dog before, when I had to go to Springfield, I think we're lucky to have them that close that they can save the dog, actually.
Yeah. Yeah. There was,
So-
I mean, yeah, they really knew what they were doing. It's
Yeah.
just unbridled capitalism.
Yeah, it takes your breath away.
Yeah, no kidding. Wow.
Anyway, enough of that. Let's get on to the beaver questions.
Oh, it's beavers again?
No, it isn't. He's just making this up.
He
Yeah,
wants, yeah.
let's have a meeting. This is the Board of Health meeting of September, what's this, the 20th?
20th.
Yeah.
2023, and the whole board is here. Me, Catherine Hilton, Arlene Reed, Garrett Simonson, Wim Levine, and Noreen Pease. I was just about to say Noreen's iPad because I'm reading across the screen. And I apologize. I should have just canceled this meeting. By the time I realized that I could have canceled it, it was basically
Too late.
we might as well just go on. It certainly would have made my life better not to have this meeting. So the only things on the agenda that I have, I think, are one, the minutes from last time.
Perfect.
Good with me.
Yep.
Okay, all right,
Approve.
okay.
Second.
What? All in favor?
Garrett,
Okay.
Aline, yes.
There it is. Now, the other thing that I had put on the agenda was, I guess it's 173, anyway, it's a place on Locks Pond Road where it's recently changed hands, and so has the place next door to it. And the new people in the next door complained that they hadn't had a Title V inspection, and that the lot was very tiny, and that that it had been empty, but that somebody was now going to be living there full time. And so they were concerned, and I was thinking that we were going to have to order them to have an inspection and so on. But I put it on the agenda, and somebody let the new owners know that it was on the Board of Health agenda. And so they turned themselves in. One of the new owners called and asked for guidance and said that it had been a hasty sale, but that they intend to do the Title V inspection. And I gave her instructions about that. And also that nobody's going to be living there for the time being. They also own the house on the other side of it, away from the other new neighbor, and they're going to be moving into that house, but they're not going to be using the house in question, which is that little red A-frame over on Locks Pond Road.
Oh, okay.
Yeah.
Oh, good.
And
That's sold.
by the way,
Good.
this is 371 Locks Pond Road.
Oh, thank you.
Right.
Right. So the same people own 371 and they own 375.
Okay.
And it's on the other side, whatever is on the other side. I think it's 369. That's the one that was concerned.
Oh, okay.
So they will go ahead and get the Title V done.
Yeah, I talked to the woman on the phone this morning, and she said the Title V might actually be happening today.
Oh, wow.
Or maybe it was just the pump out. Maybe it was just the pump out happening today in there. But you know, when they bought 375, it was 7 or 8 years ago, and they did the Title V then. So they know the drill, right? It's not like they're clueless here. They just
Okay.
you know, things were complicated.
Mhm.
So, but that seems to be all in order, and and speaking of orders, we don't have to write one or get one written ordering them to get the Title V inspection done, because they're on the ball with that.
Okay. It's interesting that the sale was able to happen without that inspection. How did that slip through? Don't, maybe there was
I can tell you how.
involved? Okay.
It was a private sale, more or less within the family, even though the buyer was not on the old lease. And it was, I guess it was a cash sale. There was no bank. And they were moving quickly because the seller is in poor health. And so they just, you know, because it was a family thing, they just went ahead and made the transfer and put off the Title V and some other things that they have to do a little bit into the future.
Okay.
Yeah, normally it doesn't happen, although I think it may happen more often than we realize, because usually we don't get complaints about them, but often, you know, I'll look back into the files to see the Title V and there isn't one, right? They might get one, but it doesn't always get reported to us, I think. Right? You'd think that would be the easy part, because I mean, it's right there in Title V, right? You have to send a copy to the Board of Health. But there it is. And you know what? That's all I have. Do we have any other reports or gossip or anything to share?
I have a question, since you know, I've been reading more about what's going on with the new proposed regulations with the Concom.
Uh-huh.
And there was some comment that it will impact on septic. Can you enlighten me what that means, or how so?
No, I can't actually. At present, and I'm not exactly sure what the authority for this is, at present, you know that the setback from surface waters and wetlands is 100 feet for a leaching field. But we, in the case of a repair where there are no other variances, we can give a variance and go as close as 50 feet. And it might be in that space between 50 and 100 feet that they want to exert their authority. And that's something that I need to find out from them. I would expect that if we gave such a permit, and we frequently do around the lake because there is
Right.
that we would expect them to impose conditions on the installation to keep the upheaval of the installation from affecting any surface waters or wetlands. What we wouldn't expect them to do would be essentially to void our permit by you know, not giving their approval. And so that's the thing. I don't know that they have the intention of doing that. But that's something that I need to find out.
Okay, thank you, that helps.
I think that would be the only case in which there would be any kind of a problem. I think my impression is that it's less severe for surface waters than, say, for a vernal pool, right? They don't want to have anything within 100 feet of a vernal pool. But we don't have any vernal pools around the lake. And
No.
in the places where we do have them, there's usually plenty of property around. I don't think that we have ever issued a permit for, you know, closer than 100 feet from a vernal pool.
Okay.
So I was going to ask these questions at the abortive hearing the other night, but
Right. Because we, I guess, There were so many people that it closed the Zoom meeting down, apparently, shut it down.
It didn't shut it down, but it was turning people away. People were
Oh.
trying to get into it and they were being told that it was full and they couldn't get in. But that can't, that's not a public hearing if
Right.
we're being turned away.
Right.
Of course, it was a little different from what you would imagine a public hearing to be, because the public in the hour that the meeting was in session, the public did not get a chance to say a single word.
All right, I have another question on another topic, and I understand the two vaccines have been approved, the new vaccines.
Yes, last week.
Oh, wow, I failed to pick up on this. What can you tell us?
Well, they were approved, but they're not widely available yet. Private companies like CVS have ordered them. They're expected to be in any day.
And you say there's two vaccines.
It's Moderna and Pfizer again, correct? Wen?
Oh, okay,
Correct.
so from basically the same thing from the two companies.
Right.
Mhm.
I was
It-
looking at Walgreens today and they had a ton of
They were there.
yeah, they had a ton of appointments available even today.
No kidding.
Great.
Okay. And I think the Valley Health Coalition is we're meeting Tuesday night, I think it is next Tuesday, and we're going to be talking about the public clinics when they'll be held. So I'll have more information on that.
Oh, they're gonna go back to having public clinics?
Well, Greenfield and Deerfield and Montague always have
Uh-huh.
cats. So, I'm sure we'll be invited to their clinics. We always have been invited to their
Right,
clinics. But
right.
yeah, so they'll be posting when they're having them and where and that kind of thing.
And Noreen, I'm not available for that meeting. Are you?
I saw that. Yes, I'm back, and I'll definitely go to that one.
Arlene, how? Oh, I'm sorry. Go ahead, Noreen.
No, that's okay. Go ahead if it's related to this, and then I just have one other thing to say, Wim. So go ahead.
I just wondered, Arlene, with the public health monitoring, how prevalent is this spike?
Well, the thing is that we don't have complete information because most people are doing home testing and not reportable clinical testing. And so I have not been seeing a lot of new cases. When people do home tests, it's they're at their discretion as to whether they report it to us.
Yeah.
And I've had a couple of reports, but only
Yeah, so there's a lot of anecdotal evidence.
Yes,
right?
exactly. And so I've had a couple of each, couple of the official Maven reported cases and a couple of self-reported cases over the last few weeks, but that's about it. Sarah Fisk, our public health nurse, is primarily monitoring Maven. I still, old habits die hard, and I check it every day anyway, but
Good.
but she's always on there before I am, and so is one of the other nurses at Greenfield, so that we've got three eyes every day pretty much on it. And so anyway, there has not been a lot turning up in Shutesbury.
And today they're saying that there will be more tests available through the Postal Service again.
But not free, am I right? Or are they free?
What I saw was free.
Okay. I
Yeah.
think the free tests that are free of cost, that will be probably coming to an end sometime soon. I think that's dependent on whatever the acronym is for the funding that was in place.
Mhm.
Anyway, if it's still free, that's great. If they are still free, that's great. What else was I going to say? Oh, I know. I think there is a way still for me to take a look at what are the numbers in neighboring towns. Like a table where I could see what's going on in Amherst or Greenfield, et cetera, because I know it's not just what's happening in Shutesbury. Most of us, we're out and about and we're taking care of our daily lives in places other than Shutesbury. And so that matters as well. And I don't have a handle on those figures, but I can try to find that out.
I think
But-
I may be wrong, Arlene, but I think they're doing the same thing they were doing all along and having the, what was it, red, yellow, and green levels by town?
Yeah, there may be. I haven't looked at that.
I think they're still
those
doing that.
a long time. I'll take a look and
Yeah.
I'll forward along to people what I see. Yeah. Meanwhile, the arboviruses are rising, not in Franklin County, but positive, mosquitoes positive for both Triple E and West Nile virus have been found, and somewhat close to home. Some Hampshire County figures, some Hampden County, and definitely Worcester County. So that the risk for in Shutesbury currently, the risk for West Nile virus is considered to be low. For Triple E is considered to be remote, remote being lower than low. Remote is the least risky category. But you don't have to go too far away to get into a community where the risk is moderate. So anyway, Kat, I think you sent out an alert, an all-town alert, which reflected essentially that people should be careful around mosquitoes, and not that we're in imminent danger here in our own backyards, but
Right, as far as we know.
right.
Right, yeah, it seems concerning that there are more bridge vectors than they anticipated. I mean, usually it's this one mosquito and maybe some other ones, but
Yeah, and I
it's
think
spreading
yes, exactly.
among the mosquito populations.
Does it mean more than that one mosquito that where they were putting the traps around that one kind of swamp? I don't know what to call it, flower or swamp?
Cattails, it was at the base.
Cattails, it was
Yeah, it was
cattails,
at
okay.
the root of the cattails. Yeah, it's gone
Mm.
into it's gone into other mosquitoes. And if you go to in the thing that I sent out, there's a link to the risk analysis page from I guess DPH. And you can see that the mosquitoes that were triple E positive are like 5 different species.
Wow.
Yeah.
Okay.
So that's, that's of concern. I mean, we all know how we've been telling everybody how to not get bitten by mosquitoes for years, right? We just have to do it.
Right.
All right, I have one more thing. MAFCO, it looks like we've had some people apply for the emergency preparedness planning job, which is good.
Oh, good.
So we're going to be meeting, I think Monday afternoon to review the applicants and hopefully, make some choices and perhaps interview one or two of them. Our goal has been to try and have someone on board by October 1st. So it should be somewhere around that time, when we would have someone available. So that's good news.
That is good news, because you were afraid nobody was going to apply.
I was afraid of that. I was. So, I'll know more. I'm on the committee. I'll know more next week.
Great. And who was our planner before this?
Dan Nietzsche, who is still at FERCog.
And before that, who was it?
A woman, I'm blocking on her name because she came to us and then she took leave for 3 or 4 months and was gone, and I can't even remember her name, to tell you the truth. Isn't that awful?
Yeah.
He came to the exercise that we did at the school.
I remember her.
Yes,
Yeah.
right.
Yeah,
Can't remember her name.
no. Yeah, no, she didn't make any impression at all, really.
No.
Okay. Right.
This time, we've rearranged the budget and we've made quite a bit more money available. I think it's $105,000. So hopefully we will interest, someone who has some experience and will do a good job.
Great. That'd be great. Do we have anything else that is of interest to the Board of Health?
I have nothing more.
I move we adjourn.
Second.
All in favor?
Yes, please.
Yes.
Yeah, I like that. Yes, please. Okay, all right. We are adjourned. I'm gonna turn off the recording if I can find it, but